All right, so for part 2, I'm going to complete the ear assessment by doing the whisper test. So go ahead and cover up one of your ears. Yeah, that ear, and then I'm going to whisper, and then you just tell me what you hear.
99.
Good. All right, let's do the other side. Go ahead and hold that ear, and then I'll do the same thing. 1, 2, 3.
1, 2, 3.
Very good. Okay, so then we will move over to the Renee and the Weber test, and I will use my 512 tuning fork to do that. And so I'm going to activate the tuning fork. I'm going to place it in position, and then you're going to tell me this is position A or position B. What do you hear the greatest? Okay. A, B.
A.
Okay. Let's do the other side. A, B.
A.
Okay. Very good. And then we will do the Weber test. So you're going to tell me if you hear this vibration on both sides equally, or if you hear it on one side or the other side greater. Okay.
Equal.
Okay. Very nice. Okay, next I'll move over to the nose, and I'll observe symmetry of the nose. Do you have any smelling or taste problems or smell? So that would be the cranial nerve 1. And so I'm going to just observe for redness, drainage, anything like that, and there's nothing noted here.
You dropped something, Daddy.
It's okay. Okay. Okay, so then I will look inside of the nose and observe the superior and the middle and the inferior turbinate. Okay. Okay. Good. Next side. Okay. Looking good. No redness or drainage noted there. Okay. Next, we will move over and to look at the mouth, and we'll just observe the lips first and the buccal mucosa. So if you just open up your mouth real wide for me. Good. All right, stick your tongue out. All right, that is the 12th cranial nerve, so it's midline and not shifted to one side or the other. I'm going to just take this tongue depressor and actually look inside of the mouth, and I'm going to take my light and shine in there. And I'm observing for any periodontal disease, inflammation of the gums. I want to move the tongue over over this way and look for ulcerations, anything like that. Everything is pink and moist and looking good. Her tonsils are a +1. Okay, next we will move to the trachea, and we will look and observe and see that it is midline, it's not shifted one side or the other. And we will palpate the carotid arteries on both sides individually. Okay. And then I will observe for JVD. Just lean back just a little bit for me. 45-degree angle is the best angle to do that, but I don't observe any JVD there. Okay. Now I'm going to listen for any bruits or thrills. Okay. And there's nothing noted there. And then lastly, I will move to the thyroid, and I will first get in position. I will palpate the cricoid cartilage. That's my first landmark. And then I move down from there and over and palpate right around here is where the thyroid is. And then go ahead and give me a swallow. I'm going to palpate to see if one side moves more than the other side, if they move equally, and they do. So that concludes the head, eyes, ears, nose, and throat assessment.